Hello, everyone. My name is Jada Price, and I am a gynecologist here at Memorial Hermann Hospital, located in Sugar Land, Texas. So I specialize in reproductive and women's health issues. So for tonight, we are going to be talking more about the common syndrome that is being dealt with over America, also known as polycystic ovarian syndrome or PCOS. So there are around 1 to 10% of women dealing with the syndrome during the childbearing age. And overall, there are a good amount of 16 to 20% dealing with this syndrome all over America. So this means that an excessive amount of hormones, such as the androgen, is rapidly increasing. So now it will be changed into the male-like hormone, also known as testosterone. So the symptoms that could include is a plethora of infrequent, missed, heavy, light menstruation. You can have severe acne, facial hair, skin tags, failure to bear a child or infertility, frequent cysts on the ovaries, etc. So there are ways to help with this syndrome, losing a significant amount of weight, being on medications for both weight and facial hair. So for facial hair, it would be spironolactone as well as metformin, which is for the weight. So stress is a big factor on both your mental and physical well-being. So with this can increase your blood pressure. So we wanted to have the patient to be able to have activities that do not protrude with the stress. So obesity is also another factor that can lead towards PCOS. Hormones can also be found within the foods that we eat, such as chicken. So high processed foods is not really good. So eating the right foods can help with this, and you will see a big change. Medications that could help with your ovaries are also certain types of treatment. But on the other hand, this might deal with symptoms during pregnancy. I heard that most of these symptoms that kind of deal with the medication with the ovaries tend to give you more than one child. So you might develop twins or triplets. It just depends. So yeah, that could happen. Birth control pills are another resource towards the calming of the severity of the symptoms. But unfortunately, there is not an actual cure for PCOS, so a duration of treatment is not possible. So for my patient, she is a female. She's 25 years old, race African American. Her socioeconomic status is the lower class. And the previous medical history, which is high blood pressure and obesity. So what I recommended for my patient is to start a healthy, clean Mediterranean diet. Most of the Mediterranean diet deals with more of the fish, non-fats, non-dairy. It just it's really low and simple, so that could help with the PCOS. Dealing with the starches, like I said, etc. Secondly, to help with the facial hair, I did recommend her get spironolactone, taken twice a day during the morning after a light breakfast. I did want to be able to revisit with the patient to see her progress, but if it's not where we want it to be, there will be metformin to also help with that, because we don't want her to be on the high blood pressure pre-diabetic medication to help with that, and it kind of would probably disrupt with the hormones because she's taking way too many medications, so that would kind of make it a little bit harder for her to lower the symptoms. So I would like to say overall, as women, this is not being talked enough. Adolescents should be more aware of the syndrome. So due to not being diagnosed around this time of age, I would like for all of the schools to add the importance of PCOS along with the sex education. So there should also be more awareness or organizations toward this. The female gender that is affected should not be suffering in silence. To the other health professionals dealing with this syndrome, you're wonderful. So without you, the vast majority of women would not have been able to figure out this diagnosis. And on the other hand, I believe that more technology and funding should be going into PCOS, dealing with more research, such as what could help stop this progressive syndrome. And then there's other many problems that also include what if the female is wanting to bear children but can't? What is another alternative if she cannot conceive? And what percentage of accuracy will this actually work? Will this help her conceive? And then there's also how can we help the patients mentally? Like, this can drive them into a depressive state. So that concludes the case study that I have for us today, and thank you.